So a lot of our great MPPs in our area are doing some amazing things to keep us well informed of as we strive to continue to move through this COVID-19 pandemic. It's been a while since we've talked to our local MPP of Chatham-Kent-Leamington, Rick Nicholls. I'm happy to have him here today. Rick, thanks for joining me today.
Thank you very much. It's always a pleasure to be on your TV.
So I got to ask you, since our last little discussion, a lot has changed. So just want to kind of ask, how have you been doing during this almost a year since we've had our last little chat?
Well, fortunately, my family and I are healthy, and we are, like everybody else, we're a little bit frustrated with this virus. But I do know that the premier and, of course, the science table and our command table, we're doing our best to try and get to try to keep the people of Ontario safe. And that can, in fact, be a challenge because you're dealing with many different personalities and individuals. Some are grateful that we are in a shutdown / lockdown / stay at home. And that kind of happened like one right after the other just recently. And others are very antsy and want to get out there and be with family. That causes some issues and challenges. I'm concerned about some of that, but you know what? I mean, we've got to get the curve flattened. We've got to keep people healthy and keep them safe. That's the big thing.
Absolutely. And there have been so many great government grants as we've gone through the year. Monty McNaught has talked about second career programs. We've had, the sick days have just shown up, and, small businesses are striving to want to open those doors. And, we're doing everything. I think everyone's doing everything they can. And hopefully we start seeing some of that. So our little neck of the woods of Chatham-Kent-Leamington, our numbers are a bit lower compared to some surrounding areas. Won't get too much into, the stats there. As you said, vaccines are rolling out. I just want to kind of say, it's hard to read a crystal ball. We wish we had, the big message into the future. I've asked kind of a guessing game with our Mayor Darren Caniff and Don Shropshire, Monty McNaughton. Haven't gotten your chance, but, what is an honest guess? How long do you think it's going to take us to get back to what I would call not even a new normal, but almost a new reality? We've got so much to look forward to. But what are your thoughts on, a new beginning?
Well, when you talk about crystal balls, who knows? A lot of this also, in my opinion, is dependent upon how well people follow the orders, whether they like them or they don't. If they follow the orders, then we can start to flatten the curve. The fact that we're getting vaccines out right now, and they're rolling out in this area, and kudos to Dr. Colby and our Chatham-Kent Public Health Unit. And of course, we're starting to roll out a lot of the vaccines in the pharmacies. That's a good thing, and we're hoping that by the end of May, a good percentage of the vaccines will be in the arms of many people, and we can start to consider what they call herd immunity. What the new norm will look like? Well, I don't know. It's hard to say. I mean, let's look at the very basics. I think they say it takes so many days, 40 days or something, to develop a new habit. And of course, the big emphasis has been on, hygiene, personal hygiene, washing your hands, sanitizing, wearing masks, doing what we're being asked of. And to some people, they're following that to the letter of the law. And to others, they have their own personal thoughts and feelings on it, I guess, and that in effect can cause a problem. Now let's talk about masks as an example. Am I a fan of the masks? No, I'm not. Is there science data out there that says masks are healthy and good for you? Yes. Is there data out there that says that masks are not healthy for you? The answer to that is yes. So then the question is, which way do you turn? So that becomes a personal choice. However, going into stores, I wear my mask. Outdoors, where I'm not sitting or standing near people shoulder to shoulder, I don't wear a mask. But if I'm going to be in a situation where I'm going to be shoulder to shoulder with people for whatever the reasons are, then I wear a mask. Do I wear it for myself? Partially, but I also wear it for other people that I may be around. Because for other people who may be more concerned about the virus, and don't get me wrong, I am concerned about it. I want and need, a healthy constituent so that we can have a healthy economy as well. Who knew back in 2018 that we were going to be faced with a pandemic, a worldwide pandemic? So we're doing our best. We're trying to get vaccines into arms of people as quickly as we can so that they can be safe. And of course, even the first shot, I understand in several of the vaccines, it gives you about a 92% immunity rate, which is very, very good. And initially, the pharmacies, not the government, the pharmacies said, well, you can get the booster shot. It's a 2-shot process after maybe a month or so, and now it's up to 4 months. Well, we didn't make that change. The vaccine people, are saying that now. But when they applied for the vaccine license and so on, they have to specifically state, what it's for and how long it's good for and whatnot. So some people are a little frustrated that it's maybe up to 4 months. But I look at it this way. Once you get the vaccine, your body begins to build immunity. And the longer it goes between the booster shot and your original shot, your body has a chance to build up even greater immunity. So then the booster shot would be even more effective. But we're saying up to, I think it's 4 months now. But people are a little frustrated with that. But hey, you know what? I get it. Some people want it like right away, and others are a little more patient, and they'll wait it out.
Yeah, well said. You touched on a lot of upcoming thoughts that I'm going to bring forward to you. But yeah, with the vaccines kind of rolling in, and announcements are being made on which age groups, different health statuses, especially now with May coming up.
Yeah.
May 20th is still kind of the lockdown of what we'll hear kind of moving forward. But another announcement kind of coming in saying, every adult, whether it's age 25 or up or wherever, will have the opportunity to get vaccines. And that's kind of a big thing for, the people, like you said, conspiracy, where people say, I'm going to get that vaccine right away, or I'm going to wait. But the answer is, this is kind of a way for us to start rebuilding our economy, rebuilding, hopefully open doors. So just kind of want to hear your thoughts, if by the end of May, every adult can have an opportunity to get the vaccine, what are your thoughts on, this moving and trying to slowly reopen up our economy that drastically needs a big hug right now, I guess you could say.
Oh, you're absolutely right. The challenge is, but let's take it to the end by the end of May, and those who want the vaccine, the majority of those people will have had the vaccine. What will the picture look like? Well, I envision more people walking the streets. I envision people walking in and out of stores. Now, maybe, just maybe, proper COVID protocols will have to be in place for the small businesses. Now, depending upon your business, I would suggest that most businesses, maybe at any one particular given time, will have maybe up to half a dozen people, maybe, in their store at any given time. And in which case that can be easily monitored, and if they say that their store can only have 4 people at a time, well, then guess what? If there's 6 people, then 2 are waiting outside until 2 more leave, and then those other 2 can go in. So that's what I see. I want to see kids back on soccer fields. I want to see little leagues playing. I want to see the men's leagues. Summertime is a time for fun and leisure, and get people out there and get breathing in that healthy, fresh air. But again, you look around and you touched on it earlier. And he said that Chatham-Kent is in fact in pretty good shape. Our numbers are very low. And I've talked with the Chatham-Kent Health Alliance, and they are now accepting people from some of the hard-hit areas. Well, where are those hard-hit areas? Those hard-hit areas are in Toronto, they're in Peel, in Durham. They're seeing the spread of the variants. They say the variants spread faster than COVID. We do have young people who are very sick. We also have a lot of older people that are very sick, and everything in between. Again, we're fortunate in our area. I have recommended and suggested to both the science table, the health table, and the Ministry of Health that maybe we go back to regionalization. In other words, my thoughts are, why do we punish people who are following the rules? In other words, we have basically a healthy community. Well, don't punish us for having a healthy community. What I believe we need to do is maybe go back to the color coding again. and that will allow some people, not all. Peel and Toronto, trust me. I go up there right now. I'm going up there every week. I go up on Sunday and I'm back on Thursdays, and it's almost a ghost town up there right now because people are not going out. They're following their orders. Most are. And then again, you get a wide spread. All of a sudden, you get a spike in the numbers. Well, what caused the spike in the numbers? And of course, you have holidays and people getting together, ignoring the guidelines that we've laid out. You have festivities. You have different things, and that's why one of the reasons why Peel, which involves Brampton and Mississauga, are very, very hard hit right now, and the ICUs are packed, and that's why I'm grateful that our area is healthy. Chatham and Windsor are in fact starting to accept patients from those areas because these patients are sick and they need to get better. So I'm glad that we're able to help out in that regards. And again, I mentioned it once, but I'll mention it again. Our public health unit and Dr. Colby and for the most part, the people of Chatham-Kent-Leamington are doing their part to stay healthy. Do they like the rules? No, they don't like the rules. Do I like the rules? Not crazy about them, but I realize that it's important to have these rules in place right now so that we can get things done.
Nobody likes rules. I mean, rules have been around since the dawn of time when, even if it's a non-fictional book like The Sheriff of Nottingham coming and taking your taxes right out of your pockets, we've been strapped with rules. And, every time we hear a new rule or a new restriction, for example, May 20th, we're all waiting on bated breath to see what the new announcements are going to be. You touched on going back to regional, we don't all want to be on the same color of a paintbrush, because one area is affected. We're all doing well here. But we're waiting for these big days, and we get bad news all throughout the time. But throughout this time, we also have a lot of good news stories. We have a lot of great organizations that are trying to do their part to boost morale. So in your time, whether you've been lightly traveling or just going from face to face, do you have any good news stories kind of to share through these dark times from your team?
Well, you know what? Again. Yeah, there's a lot of good news out there because I think people are getting to the point where they didn't even want to turn the TV on to watch. They'll turn TV on to watch YourTV, but but to watch the news, it's like, give me a break. Like I don't need a play-by-play every day and the numbers and so on and so forth. And we get acclimatized, I suppose, to it. But you know what? There is some good news that I've been pushing for. When I look at in the areas of our children, the Children's Treatment Center, there was an announcement just recently, and when I was with the Premier back in the fall, and we visited the Children's Treatment Center, I've been pushing for that center for probably 4 years or so. And kudos to the executive director over there, Donna Litwood Mackey and her team, and Mike Genge and for fundraising. That's going to be a reality. They have their own. They have property, and I believe now they'll go out for tenders, and so that'll be good. They'll be better able to service our community from a children's treatment perspective. But also, we look at I guess one of the things that we've learned, and that's probably a positive thing, is doing what you and I are doing right now, virtual meetings. I'm sure that a lot of people would prefer to be with their colleagues. I would, but up at Queen's Park right now, the Speaker Arnott, and of course I'm the government deputy speaker, but Speaker Arnott has laid down a mandate. He said, listen, when you're walking the halls at Queen's Park, you will wear a mask. We only have a minimal number of MPPs from all parties in the legislature at any one given time. And when you're back up in your own offices, when I'm up in my office, then again, I don't wear a mask. But again, we're following the protocols to keep people safe. So to me, that's a plus. But having meetings like this minimizes the amount of travel that people have to make and take. And it's interesting. Of course, with me, I found myself on the phone at midnight talking with people or answering emails and so on. But again, this is just technology. So let's use technology to our advantage. Could you imagine that we didn't have the technology that we have today? And let's back it up about 25 years. how would we be handling it then? I think it would be far worse. Uh, Nobody planned for this pandemic. What I have found is that there's a lot of different opinions out there on how this should be handled. We're doing our absolute best. This comment might get me in a little bit of trouble, but so what? Opinions are like noses. Everybody has one, and we hear that. We hear that. And I say that respectfully.
Yeah, there's definitely a lot of moving pieces for small businesses, for mental health. We're all, as a community, all working together to wait to see, what the next big step is. And we want to see a normalization, without some of our MPPs like yourself and other, advocates who are just trying to make it a more normal place. We can't think anything for what all of you are doing. So, Rick, thanks for taking your time today. Is there anything else you would like to add as we wrap up?
I just want to say thank you to our frontline workers. And it's not just those working in hospitals or in long-term care, but it's also the people in our grocery stores. It's our truck drivers that provide the food for our grocery stores, so that we can at least have food on our tables. And there's a number of different professions, as I would call, that are involved in all of this. And again, if it wasn't for them, we'd be in dire straits right now. So I just want them to know that I truly appreciate all the work, all the efforts that everybody's doing to help our community and to help those less fortunate as well. I think that's a critical aspect, and that's what Chatham-Kent's noted for as well. Being able to reach out to those in times of need. I realize that patience is sometimes short, and people are very, very, because they look at life through their own lens, and I understand that. But again, we have to, and my job is to not just look at life through my own lens, but to look at it through the lens of the people of Chatham-Kent-Leamington, and to try and get things moving in the right direction. So, patience, they say patience is a virtue, and I strive hard for that. But again, I want to thank you, Kevin, and YourTV for the opportunity to be on your show. Let's not be strangers, and I look forward to the next time.
Appreciate all your time today, Rick, and thanks for what you guys are doing. And I hope when this is all said and done, we can have a big old Chatham-Kent block party to celebrate all the hardships we've endured.
Count me in for that one, for sure. Appreciate it.